ma famille, on a un cartilage assez fragile.
Having fragile cartilage runs in the family, and so being a high-level judoka accelerates cartilage degeneration.
L'usure de mon cartilage. Et du coup,
it was a handicap in my everyday life.
Dans la vie de tous les jours pour mettre
I'd struggle trying to put my shoes on, to cut my fingernails.
Vraiment ramener mon genou vers ma poitrine.
Bending my knee towards my chest became a really difficult task.
Dans mon sport aussi,
sports-wise too, training all week long became impossible.
Pendant une semaine d'affilée.
After training for an hour and a half, I could feel an unbearable pain which wouldn't go away, even after I'd taken anti-inflammatory drugs.
C'était vraiment impossible de rester comme ça. Et comme mon père,
my father had hip problems. He got operated. I thought that such surgery was only for elderly people, but I couldn't leave it as it was.
A hip implant is often required in all cases of hip joint deterioration. These circumstances can be traumatic as they're related to diseases or intensive sporting activities. A hip implant is often necessary when one has an intensive sporting activity associated with joint malformations. In practice, people of all ages may require hip implants. They can be in their 40s or older, but even younger in some cases.
Despite being at the top of my game in judo, I have this physical anomaly, and it devastated me. So I wanted to see a hip specialist who would look at all the different possible solutions to my problem.
The first consultation is essential. First, it's the confirmation of the diagnostic, to phase out diagnostic errors or troubles that are not originally related to the hip. And then we define with the patient his expectations and objectives in order to consider with him the most adapted treatment. If the treatment requires an implant, we are compelled to discuss this matter in depth to know which technique to use according to the type of implant required and what to expect afterwards. The patient's demands are constantly part of the conversation and play a central part in the setting of the surgical targets.
I underwent exams, x-rays and scans. I was told I had osteoarthritis and dysplasia, and that my career as a high-level athlete was over.
If someone intends to have a customized implant, then more developed examinations are required than for a standard implant. Standard implants are programmed on two-dimensional X-rays. Custom implants need a CT scan to allow the three-dimensional reconstruction of the hip. This reconstruction will be of actual size. It's absolutely essential that choosing to opt for an implant must follow complete psychological maturation. It would be a very damaging and harsh situation for the patient if he endured any pressure from the medical profession or surgeon to choose a radical intervention such as a joint replacement. If 2 or 3 consultations are required, we need to take time to reassure the patient on his current situation and tell him that he is not an isolated case, that many people live with an implant. Also, the patient needs to be reassured on his later ability to carry on with his life, activities, sport and work.
I had time to think about it. I was offered many other solutions. Deciding to opt for an implant was my personal choice. I couldn't think of any other solution, and my condition couldn't possibly get worse.
Vu que maintenant ça peut pas être pire, quoi.